I'm Anthony Kaveh, an anesthesiologist and integrative medicine specialist. And I've recently seen a very arrogant doctor for myself and a loved one. This is an incredibly incompetent, boastful individual who craves their position of power, and as detestable as this experience has been for me and my loved one, it's given me tremendous empathy for what so many of my patients have gone through. And I want to share with you some very important tips for how you can disarm the arrogant doctor who is so habitually used to just rolling patients over and colleagues and others in their lives. You can place roadblocks respectfully, with dignity, to be able to get the care that you deserve. And it starts with you first understanding that arrogance and confidence are two very different things, and you're going to call out the arrogant doctor, not the confident doctor. The biggest difference is competence, because competence is an act in the arrogant doctor, whereas the confident doctor is competent. Acting competent versus being competent. That doctor who is arrogant is often boastful, has some element of self-entitlement and requires external validation. They seek praise from others. The confident doctor is the one who is more silent and observant and takes the perspective of those in the room, the patient, the loved one, whoever else is with them. And it's not about I know and you don't, like the arrogant doctor. It's more like I know, let me help show you, let me share with you and your loved one and whoever else is meaningful, because healing is kind of a team sport in many cases. So please learn from what I've had to go through so that you can better advocate for yourself. Number one, to disarm the arrogant doctor is to surprise them with one of the best questions I've ever had patients ask me. Doctor, what is the number needed to treat for that intervention? So this is a big question, right? It will catch your doctor off guard. We have to break it down so you understand it. An intervention in medicine can be anything from a medication to an injection to a surgery, a procedure, whatever. That's an intervention. The number needed to treat is what you're going to ask your doctor. It's going to throw them off guard. They're going to know that they're not dealing with just anyone they're going to roll over, because you're an educated, knowledgeable, and you're respectfully asking a question. So you're a respectful, knowledgeable patient who isn't just going to take whatever the doctor dishes out. The number needed to treat is the number of patients that need to receive an intervention for one patient to get the desired benefit. What does that mean? Let's look at aspirin, for example. Patients come to me every day. Doc, I take a baby aspirin to prevent a heart attack. How many patients need to take the baby aspirin for one patient to not get the heart attack? You guys give me a guess. I'll give you a shout out to whoever gets anything remotely close to the right number. What is the number needed to treat for aspirin, baby aspirin, to prevent heart attacks? Crab, good to see you. Michelle, Jody, Chris, RN. I want to know, okay, oh great, Roxy says 100, Butterfly Kisses says 250, the original Manalolo gal says 1,000. Well, 1,000 is kind of close, so is Butterfly Kisses. About anywhere from 300 to around 1,000 patients need to receive a baby aspirin for one patient to not get that heart attack. Unfortunately, the number needed to harm is kind of similar to have a bleeding event. It's around 1 in 200, depending on the study, depending on the patient population. No, how about Fosamax? Women who are postmenopausal, who have bad DEXA scores or have negative T-scores below like 3.5, how many women have to take a Fosamax for one vertebral or one hip fracture to be prevented? That number depends on if it's a vertebral fracture, it's around 20. If it's a hip fracture, it's around 100. So that means 20 women need to take the medication for one vertebral fracture to be saved. How about, this is another one that you'll find interesting, Seroquel, or an antipsychotic for fibromyalgia. That's 1 in 8, meaning that about 8 patients need to take the medication for one to have the desired benefit, whether it's mood, pain, etc. Unfortunately, weight gain from Seroquel is about 1 in 10, 1 in 12, so you're weighing risks and benefits closely, but this is the discussion that's going to disarm your doctor. You know what an intervention is, you've narrowed down what their plan is for you, and you know what a number needed to treat is, and you are going to make sure that your doctor knows what you're talking about and gives you the answer that you deserve. Because if you're not a part of your healthcare team, what's going on? And any arrogant doctor is going to have to listen to you and partake with you. I'm not saying all doctors are arrogant, and some doctors are arrogant because of the system that they've been thrown in. But number 2 will help you along this course as well. And that is to try to prove their superiority. One of my favorite phrases is, "Hi, Dr. Joe. Dr. Jane recommended me to you because you are an expert in treating endometriosis, fibromyalgia, IBS, irritable bowel syndrome, dyspepsia, my lower back pain," whatever it is. It's not about feeding someone's ego. That's not going to be helpful. But when you place remember, these are individuals that crave external validation. Unlike the confident doctor, they don't have as much of an internal locus of control. And you want to be respectful and be honest. And if you have been referred by your primary care doctor, for example, tell them that up front. You will likely catch their attention. And if nothing else, because they want to save face for Dr. Jane, they're going to have to respond in some meaningful way. It's not about being manipulative, it's about being honest. Dorothy Hawkins, thank you so much for that kind super thanks. Very, very nice of you. So let's go to number 3. This one is going to catch someone off guard. At the end of your visit, if you're having a problematic patient-doctor relationship, say, "Doctor, how do you think our visit is going? Or how do you think our visit went? How do you think our last 2 visits went? How do you think this consultation is going? Do you have a clear plan for me?" Why is this going to make their ears perk? Because number 1, patients rarely ask this directly from a doctor. They might fill out a survey afterwards. "Doctor, I don't get survey responses very often unless there's something egregious," which thankfully for me has never happened. When a patient asks me in person though, I'm like, oh my gosh, this patient really cares about getting better. You can't blow someone off like that. It's not disrespectful, it's not threatening. It's being genuine and authentic. You will make their ears perk up because they can't blow you off. If nothing else, because they need to also explain to their employer what they're doing. And if people are unhappy, it's not going to look good on them. So, not threatening, it's being respectful, ultimately compassionate. Number 4, the nonverbal cues. I like this one a lot as well because you've seen individuals who are kind of fidgety, a little bit uneasy. If the environment is appropriate with your doctor, you can always say, "Hey doc, you look a little anxious. Have you done this before?" You don't want to be, once again, bullying or being threatening or being, don't want to be mean, right? But I've had patients before surgery. A funny one they ask me is, "Doc, how many of these have you done before?" They're not saying it in a way that's meant to make me feel bad. Maybe they're trying to diffuse their own distress, and it's a coping mechanism for them, but it can help break the ice. When you want to disarm somebody who is so focused on their box of superiority because they're a doctor, take them out of the medicine box for a minute. Ask them about sports, the weather, friends, maybe politics if it's right. It's kind of a touchy one, I know. Cindy Watson, thank you for that super thanks as well. That's very nice of you. You want to take someone out of their element. When they're used to rolling people, running over people in their element, take them out of it. And asking them a humorous question might be very appropriate in the right setting with the right doctor. If you appreciate me coming in here, by the way, after a long day in the operating room, I'd really appreciate it if you hit that like button and share these tips with others, because nobody deserves to be treated like an inferior or made to feel dumb in a vulnerable setting with someone in a position of power like one's doctor. And I'm very sensitive to this because, for lack of a better word, it pisses me off to see patients suffering at the hands of arrogant either doctors or other caregivers or systems that treat patients just like another like tool in a meatpacking factory or another, just assembly line item. And you deserve more care than that. And that's why I want you to take these, hopefully to heart, write them down, use whatever resonates with you in a way that ultimately speaks to what you're trying to gain. You don't want to put anyone in a bad position. I'm not advocating for that. You don't want to be mean. You want to be authentic and honest, which takes us to number 5. Because your honesty is one of the most powerful cards in your deck to advocate for yourself. What do I mean by honesty? The patients that get me to almost like shed a tear, I don't do it often not because I'm a cold-hearted person, but because we have a professional face. I once had a patient before surgery who said, "Doctor, I feel very uneasy. The staff who checked me in didn't know what they were doing. I've been asked the same question over and over again. I don't feel safe before my surgery." They weren't being in my face. They weren't being belligerent. They weren't trying to put me down. They were in a moment of vulnerability and they were being honest. Boy, did I make everyone stop talking. I closed the curtain around the patient. I just sat down with them eye to eye to help explain to them what was going on. "Hey, Donna, I appreciate that super thanks. It's very kind of you. Thank you." So that honesty went a heck of a long way. Another one is that plan, doctor, makes me anxious. So you have to understand a plan is medical speak for what doctors get paid to do. The plan, it's actually the assessment and plan. This is the doctor's end product from any visit with a patient. And you are entitled to know what the plan for your health is, what the doctor assesses you for, and what the plan is. It's so important for you to be confident in what the plan is. If you say the word plan, any doctor, especially one educated in the West, will know exactly what you're talking about. By the way, Mel Dorr, thank you so much for that super thanks. Very kind of you as well. When you say, "Doctor, I don't understand the plan. I don't feel confident. I feel uneasy. I feel anxious with that plan. Can you please better clarify it for me?" You will make even the most arrogant and narcissistic doctor have to pause. Because if they can't deliver the plan, that is their one and only job that's indisputable. I'm not saying to be a jerk about it, but you're entitled, you have to know. And too many patients are so insistent on impressing their doctors, which isn't bad. You want to be a team player, but you can't do it at the expense of just nodding your head and smiling and not knowing what your plan is. One that is very powerful is if you can be confident, if you truly are confident in what you want. Let's say you confidently want to heal. Look at your doctor, say, "Doctor, I don't understand your plan." It took me a while to have the guts to be able to say this to others. But when I did, it disarms people because they're like, "Wait, what didn't you understand?" They might try to walk over you, but if you're confident that you don't understand it because it wasn't explained well to you, you're going to stun them. And they're going to be like, "Whoa, wait, did I not explain myself?" You will likely have some degree of success, if not tremendous success, if you use all of these strategies together, applied to the right doctor in the right patient, in the right patient setting. So please don't be afraid to be honest and authentic. If you don't understand the plan, which is the reason that you're there in the first place, if you're uneasy, anxious, you're not confident in it, you don't trust it, it's not going to work for you or your loved one who's going to be taking care of you, you tell your doctor and be confident because you want to work with your doctor. And I'm going to end by saying that, yes, there's many times you may need to switch doctors. But the reality that you have all told me is that you might live in a rural place where there's one cardiologist, one kidney specialist, only one spine surgeon. You can't just get up and leave. Maybe your insurance makes it prohibitively expensive to get up and go to a different doctor. For any number of reasons, you don't want to go see another doctor. Maybe your doctor has been kind in the past, has a good relationship with other family members. For any reason, you don't want to just ditch doctors without giving them the right level of input and feedback that will help them be better for you. And I'm not saying to suck up to them, but I'm saying that you want to make them an active part of your care team, just like how you need to be an active part of your care team. You need to take responsibility for your health. if you want to heal. And your doctor has to take responsibility for being a compassionate, kind, and competent healer to empower you in your advocacy to heal. So if you can't find another doctor, these are when these tips can be helpful. So you can get by until maybe the time when you can change doctors. I don't want to be oblivious to the fact that not everyone has the luxury of switching to a different doctor on a dime's notice. And as always, hey, JW, thank you for the kind comments. I hope that you appreciate that doctors often are not narcissistic. Deep down, they don't start off that way. There's been a lot of jading, a lot of hurt. I'm not justifying what any doctors did, especially not this doctor that I said has been disgusting in their treatment of myself and my loved one, but trying to be empathetic back to them will only help you on your healing journey, because that anger and frustration that's projected out towards them will only hurt the projector, the person who projects that back onto them. Not condoning their actions, but recognizing that you getting angry over their actions, as Heidi told me, you can't let the ugly of others take away the beauty of yourself. I hope these tips help you empower yourself and feed your beauty without being succumbed to the ugly of others. Until next time, remember that you have more power over your health than you've ever been told, and please share what you learned with others. And if you hit that subscribe button to keep up with all my lives, it lets me do more of these for you and not have to ever bring in ads or product placement to help share this information with you.